Hello, everyone, and welcome back. It is the end of day 3. We have passed the halfway point. I hope that you guys have gotten some, I don't know why my camera keeps refocusing. I hope you guys have gotten some great value from the speakers we've had so far. And there's still more to come. Let me see if I can fix this camera. What is going on? Lots of technical troubles today. I don't know if that's going to help. Well, we're going to do the best that we can with what we have, I guess. Let's try this one. Okay. You may have noticed a change of scenery. I would like to spend a little time reviewing some of the concepts that I talked about earlier in the week, just in case you missed those. And then we're going to go and do some stretching. So, this camera shows a lot more than the other camera did. Let's get started. So, stretching. We're going to talk about stretching today. Let's talk about what is fascia first. Let's go back. So, fascia is the dense, sticky, connective tissue that kind of holds you together. It goes top to bottom, front to back, side to side, all the way down to your individual cells. It's everywhere in your body. You can see in that picture on the right, there's a muscle coming off some bone, and there's fascia wrapped around the outside of those muscle fibers, and there's fascia wrapped around the inside of those muscle fibers. And so fascia really is everywhere. You have loose connective tissue, your fascia, that's the stuff that's more everywhere, and then you have thicker lines of fascia like these. So from left to right, you've got your superficial back line, superficial front line, your lateral line, your spiral line, your deep lines, and those help provide counterbalance to your movements. And so what does fascia do? It provides protection. If you slip and fall on the ice, it's going to squish out its fluid, and it's going to provide structure to those parts of you that got injured, and it's going to facilitate your body reconnecting those lines and rebuilding that tissue. And it's also for proprioception, which is how your brain knows where your body is in space. So if you're dancing, it's how a ballerina knows without looking what she looks like, what shape her body is in. It helps prevent friction. It has a whole bunch of hyaluronic acid in it that prevents your muscles from rubbing against each other too much when you contract them, because your muscles are all in groups. And so when they're working together, they need to slide alongside each other. And then, like we said, it provides structure. So those deep lines will counterbalance some of the movements that you're trying to do. How do we take care of it? Hydrate. Like we talked about, when you get injured, your fascia squishes out all of its fluids. So in a normal system, if there's hydration available in the body, it'll reabsorb that and it'll go back to normal. But it becomes dysfunctional if you're dehydrated and it can't find the moisture that it needs. It might go looking for it in your brain, which is the most hydrated part of your body, and that can cause a whole range of other symptoms. Movement, and not just lots of movement, but a variety of movement. You need to move all of your joints and all of the planes that they go. You need to move from morning till night, and that is kind of the biggest takeaway to fascia. Getting good sleep, and this kind of goes with the next one, which is managing stress, and we're going to talk about that a bit today as well. When you're stressed and you're tight and you're tense, and your body recognizes that, your fascia will thicken over those areas. And so it takes time to work those out and get your muscles relaxed again. And when you feel like those knots in your back, or you carry your tension in your shoulders, that's not actually your muscles, it's your fascia, but they've gotten tight because your muscles are continually contracted. And so then your muscles are unable to relax. And so then, since your muscles are already tight, if you go to contract those later, they spasm, and those are so painful. So drinking enough water, getting lots of movement, getting good quality sleep, and managing your stress will go a long way to help keeping your fascia healthy. I want to do a breath check with you guys. So wherever you are, try to stack up your posture, and I want you to put one hand on your chest and one hand on your stomach, kind of below your belly button. Then you're going to close your eyes, and I want you to relax and breathe normally. And just allow your body to move your hands. And just take a few breaths and relax. And what I want you to notice from that is which hand is moving more. If you caught Dr. Tamara's presentation yesterday, she talked about proper breathing and how your diaphragm pulls your lungs down, but when your diaphragm contracts, it pushes all of your abdominal organs down as well to make space for your lungs. And so your lungs should be filling into your belly, into your back, into your sides. Your ribs are kind of like bucket handles, and they flip up to make more space when you breathe properly, which stretches the muscles and the fascia that's in between your ribs. And so if you're breathing up here, you have some muscles in your neck and some muscles in your chest, and those muscles in between your ribs, and they are all considered to be secondary muscles of respiration. So when your body is in flight mode or fight mode, they're the muscles that engage to help bring in as much oxygen as possible. But there's a bit of a back and forth, because when you're using those muscles, they're telling your brain that your body's in panic mode. And so your brain thinks that you're constantly under stress. And so you are creating more stress within your body if you're sucking in your tummy and trying to breathe in your chest, and you can't just relax everything and let your breath be natural and low. So the importance of breathing, I kind of touched on it a little bit already. It's a lot more than just oxygenation. It's a lot of your interaction with your world. You know, we breathe all day long, but how often do we really think about what we're doing? How often do we, unless we get out of breath, and I'm talking so fast I'm getting out of breath, I should slow down. Or if we're exercising and we notice that we're breathing really hard, or we had a really great run and we're kind of out of breath. But in a normal day-to-day, we're just going about the things that we do, how often do we think about our breathing? So I want to talk about the vagus nerve. And if anybody has ever told you, are you stressed out, just take a few breaths, I have heard from a lot of people that they don't feel like it works. But the thing is that it does, because your vagus nerve, which is a cranial nerve, goes all the way from your brain down through your body, and it innervates your gut and your stomach and your heart and your lungs. And it's part of your parasympathetic nervous system, which is the system that turns on for that flight or fight. And so when that nerve is stimulated, it tells your body that everything's okay. It reduces your heart rate. It reduces your respiration rate. It encourages digestion within your gut. It allows for better motility of your gut so that your bowel movements are easier. Your body is processing your food better. And when we're breathing into our belly and into our back, and those breaths are deep, you are actually creating pressure within your abdominal cavity that's stimulating that nerve and telling your body that it can be at rest and that it doesn't need to stress out and that everything is okay. So breathing is more about oxygenation really than anything. That's why we breathe all day long. But it has other compounding factors that it also works on. Movement. Where was I going with this? Oh, movement. We're going to talk about movement. Why is movement so important? We know I've talked ad nauseum about how movement is important. You need to move all day long. But why does it really matter? Other than your fascia, is for sensory integration. And I did my 200-hour yoga training, and it was something that I learned through that and through occupational therapy school about me. So we all know our five senses. You have touch, taste, smell, sight, and hearing. And those are the way we interact with our world and the way we perceive the stimuli that's around us. But we actually have 8 senses. You have interoception, which is your body telling your brain what it needs. So do you need to go to the bathroom? Are you hungry? Are you not feeling well? And you see a lot of times with kids that if they're having trouble potty training, or they seem to be really irritable sometimes, it may be that their body isn't correctly able to identify what it needs and communicate that to the brain. So they're having problems with their interoception. And I think it's less common as adults because we're typically able to find help along the way somewhere. You don't usually see a typically developing person not toilet trained past, elementary age. And so we do learn to figure those things out, but it's something you should know. We also have proprioception. I've talked about this several times, knowing where your body is in space. So when you swing the bat, when you're doing a piñata, how do you know which way, how high your arms are? Your brain knows because of the nerves, and they're communicating where your body is, and your fascia is communicating where your body is. And you also have your vestibular system, which is your sense of balance. And if you think about taking a shower and you're washing your hair, your vestibular system and your proprioceptive abilities are working together. So when you close your eyes to rinse out your shampoo, you know where to put your hands, and you also aren't going to fall over even though your eyes are closed. So you're able to remain standing and not lose your balance. And your vestibular system is really quite amazing. You have these crystals in your inner ear that are suspended in fluid. And so when you move, those crystals shift. And that's how your brain knows if you're going forward, if you're going backward, if you're going side to side. And this is what causes a lot of people to become motion sick. Like if you're reading in the car, you're looking at a book. The reason you get sick is because your brain doesn't register motion because your book isn't moving, but your vestibular system is telling your body that it's going somewhere. And so your brain gets super confused and it results in nausea. So all of these 8 senses work together to give us all of the information we need about our environment. But if we aren't engaging in them enough, if we aren't seeking out those sensory experiences, our brain is kind of left wondering. And going back to what I learned going through yoga school and OT school was that I think a lot of my anxiety came from a need for sensory input. So I would go to, a 75-minute yoga class that had me moving and sweating the whole time. And at the end, I just felt so good. And it was because my brain had finally gotten all of the sensory input it needed from that movement, that then it could pay attention to something else. It wasn't seeking that information anymore. It got it. So it knew where my body was. It knew how my body felt. And it was ready to move on to something else. So movement is also important for sensory integration. And that's big for adults as well as children, as my story shows. Kids tend to really like swings and spinning and things like that. And that's because they're trying to build those pathways for those sensory experiences more than we are once we get to adulthood. I went out and I got on the swings with my son the other day. And I went back and forth a couple times and I was like, oh my gosh, I was getting sick already. I can't do it. I haven't been on a swing in so long. And it's funny how your body changes as you stop doing things. He can swing all day long. He spins in the kitchen while he's waiting for dinner. But if I did those things, it would be a much different result. Grounding. This is also related to sensory integration, and this kind of shows more of what I'm saying. So there's a technique you can use called the 5-4-3-2-1 method if you're having a really bad anxiety attack or you just can't seem to get yourself settled. And you try to find 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, and 1 thing you can taste. And that provides that sensory input that your brain needs so that it can say, okay, I'm safe. There's nothing going on. I am physically present and it's okay. It needed that sensory input. And then it's able to settle down and do other things. Stretching. Okay, there were a couple things I wanted to touch on before we get to stretching, and then we will move along. If you haven't been on the floor in a while, I know a lot of adults don't typically spend a lot of time on the floor. We sit on the couch, we sit in a chair. You're not getting up and down, unless you have younger kids maybe, you're not getting up and down on the floor as much as you used to. So it may not be as easy as you remember it, just like me trying to get on the swing with my son. I haven't done that in a while. So if you haven't been on the floor in a while, go slow and take it easy and make sure you're going to be able to get back up. But I'm also going to talk about how you recover from a fall or how you get up if you are struggling to get up from the floor. We all, even if you're not talking about you personally, we all have parents and grandparents that are older and that are at risk, especially with the loss of sensory input to our feet and our balance. So if you experience a fall, or if you know somebody who experiences a fall, this is what you do. The first thing is going to be to mentally inspect your body to make sure that you haven't hurt anything. Did you break your hip when you fell? Did you fall and smack your head? Sometimes that falling experience is so scary that your adrenaline jumps in and you don't immediately recognize that you might have been injured. And so you need to take a minute and take a couple breaths and make sure that everything is okay before you try to start moving. Once you've decided that your body's okay and that you're ready to start getting up, you're going to roll onto your side, push up into quadruped, it's like crawling position on your hands and knees. You're going to check yourself again, because sometimes that shifting of your body can bring that injury into light. So once you make sure you're okay there, you're going to crawl over to the nearest piece of furniture that's sturdy furniture. You don't want to pull yourself up on something that's going to fall over. So once you get there, you're going to slowly climb up into the chair or into the couch or onto the bed, and you're going to sit down. And sometimes when you've fallen, that adrenaline can increase your blood pressure, can cause you to become dizzy, which is why you need to go slowly, and why once you get there, you need to sit down, because going from horizontal to vertical can sometimes make you get dizzy, make you to fall over again, and you don't want to do that after you've just suffered a fall, just experienced a fall. So climb up and sit down, check your body again, make sure it's all good. If you lose consciousness, if you think you have sustained a serious injury, get to a phone and call the paramedics, because you probably need help. If you are 100% sure that you haven't lost consciousness, it was just like you had tripped over a dog or something, then it's less of a concern. But if you notice that you're falling repeatedly, you probably need to talk to your doctor about it, figure out what's going on, and make sure that you're not ending up injured. I talked the other day about the mortality rate after a hip fracture is terrible. And there are some compounding factors. It's not just that you broke your hip. It's probably that you have other health-related things that contribute to that mortality rate, but the correlation is there. And so if we can work on your balance now and work on your strength now and your ability to recover from a fall, then when or if you do fall, it won't be as catastrophic. If you are helping another person up, and this is really important, you should never pull another person up. You may use them, or they may use you as support, so you can give them your arm, you can give them your hand. Don't ever let them pull on your neck. But they are the ones that are pulling themselves up using you. If you pull on a shoulder, you can dislocate it. If you pull on clothing, it's not really secure. That's why if you've been in therapy, OTs and PTs will use a gait belt, because that clothing can slip, you can lose your grip on it, and then you might drop that person again and they're going to get hurt. So they are the ones pulling themselves up, and they are the ones maintaining control. That's the end of that soapbox. Let's talk a little bit about how we stretch fascia, because it's different from when you think about stretching after you've exercised. Your fascia needs low load, long duration, which means you are holding a mild to moderate stretch for longer time periods. It's not you're going to rip it open or rip apart those restrictions. What you're going to do if you stretch too hard is actually cause injury, because that fascia isn't going to rip, but it's going to tear apart the structures that it's attached to. Maybe your blood vessels, and you'll bruise. maybe your nerves, and you'll accidentally create more pain within your body. It could just be minor damage that results in chronic inflammation. And chronic inflammation actually begins to degrade the tissue in that area. So this is not a no pain, no gain. You do not want to hurt, but it may feel a little stretchy. It might burn a little bit or be tingly. You might feel your muscles twitch. It might feel warm, and that's an indication that there's blood infusing that area. But you really just need to be patient. It's about taking your time and focusing on the sensations within your body and relaxing, because that fascia is not going to release until you can relax. And that's why we spent so much time talking about stress management, because you need to be able to let your body go for it to heal itself. So I want to do a breath count, and this is the best way to stretch. So I'm going to get my timer out, and I'm going to start, and I'm going to time you for 30 seconds. And I want you to not take super deep breaths, but I want you to breathe a little deeper than normal. It's not shallow, it's into your belly, it's a full breath, but it's not like an 8-count breath, if you've ever done any of those. And don't hold it at the end. You just want to breathe, fill your lungs, and let it go naturally. So I'm going to start my timer, and I will tell you when to start, and you're going to count how many breaths you get in 30 seconds. So start counting now. Stop. So I got 5 breaths, which means it takes me 10 breaths to get through a minute. And this is important because when you're thinking about stretching your fascia and you're laying down and you're relaxed and you're calm, you don't want to be focused on the time, because then you're not really relaxing. You want to be able to focus on your body. And so by counting your breaths, so I know that I need 10 breaths to get to approximately a minute. So I can lay down and I can get into a stretch and I can focus on my breathing, which is beneficial all by itself, but that also allows me to measure my length of time that I'm in that stretch and make sure that I'm stretching it long enough. So remember your number, write it down if you have to. You can stretch as long as you want to. You will notice after a couple minutes, usually 2 or 3 minutes, that it doesn't feel as tight, or it doesn't feel as stretchy, or where you feel the warmth may have moved. And that indicates that you might be ready to change your position a little, so you might be able to go a little deeper to get back to that mild to moderate level of stretch, or you might be able to change your position, and you want to maintain that mild to moderate level because those restrictions typically follow a line, and you don't always know which way that line's going to go. It's like the wrinkles in the shirt. But you want to follow that line until it feels like it ends or you run out of time. So let's stretch. I talked a little while ago, let me get rid of these slides because they're done. I talked at the beginning of the week about the therapy balls, and these are my therapy balls. They're the Yoga Tunic ones that I showed you. And they come in this nifty little pouch. And so they're good to use individually for certain spots, and they're good to use as a set for certain spots. This is great to go up and down your spine. It's also good if you have a bigger area of pain, because it is a larger surface area, and so it provides less input, or input over a larger area. Like the difference between poking the sharp end of a pencil into your hand and poking the eraser set into your hand, essentially. And I have a little, you should be able to hear me okay. If you guys can't hear me, will somebody comment and let me know? But I have this fancy different headset that has a microphone in it. So when I go over to my mat, you should still be able to hear me. And I have a little cheat sheet over there so I can remember what I wanted to do with you guys. I know when I stand up, oh, this one might not cut off my head. The other one cut off my head, but it doesn't look like I have to worry about that anymore. So let's stretch. The first thing that, if you have therapy balls, this is a really cool thing to do because it really demonstrates the power of fascia. And we talked about that superficial back line goes all the way from the bottoms of your feet where your toes are, up the back of your leg, up your back, around your head, all the way to your forehead. And so I can take this ball and I can roll my feet. And the way you do it is you stand on it, give it a little bit of pressure, hold on to something if you feel like you can't balance. A chair is really good in front of you just so you have a little extra support. And you're gonna roll until you find a spot that's a little tender or a little tight or it just feels really good. And you're gonna push into it a little and you're just gonna rest. Try to maintain your upright posture, take your deep breaths, count. You know, I get 10 in a minute, so you can count or you can just feel the sensation that you get from the stretch. So when this spot stops hurting or it doesn't feel as tight, then I'll roll a little bit. I should have backed up because this is the trick. So everybody should be able to touch their toes. I have a bit of a mechanical advantage because I have short legs and a longer torso. So I can pretty easily touch my toes. Right about here is where I can start to feel the tension in the backs of my legs. So I just have my fingertips on the floor. So I'm gonna roll, go back to my right foot, my rolling. So try to touch your toes, test yourself, figure out where your initial depth is. So how close can you get to your toes? Can you put your hands flat on the floor? Is it just your fingertips? Are you at your shins? Where's that level for you now? And then roll your feet. Roll one. Do the first one. Spend a few minutes trying to figure out where those spots are. And these therapy balls are great, especially for your feet, because I don't personally do a lot of reflexology. I don't know the science behind it, but I know that it's a pretty popular thing with a lot of people. And reflexology is really centered around the foot and what those pressure points do. And so the size of the therapy balls, when you work them into your foot, allows you to get into those intrinsic muscles that are in between the bones and kind of create that stretch and that movement that your foot doesn't get when it's smooshed into shoes all day long. So if you're following along, keep moving until you find another good spot. And if you don't have any therapy balls, I would really recommend getting a set. They're only about $15 on Amazon, and they're super easy to find. And you can do a lot of things with them when you're dealing with fascia-related chronic pain, stiffness. They even just generally feel good. Okay, so when you feel like you've got your foot rolled out a little bit, you could probably do it longer, but come back and try to touch your toes again. So now I'm back where I was. This leg is still tight. I can still feel the tension in my hamstrings. I can't feel anything in my right leg because we've reduced some of the tension in the fascia in the bottom of the foot, which has affected the entire back line. So now if we go and we roll the other foot, and if you want a really, really marked difference, you probably need to spend more time than we're going to spend right now because I want to get through the rest of these stretches with you. But this is something you can do when you are watching TV or you are standing at the counter making a snack. It doesn't work as well when you're sitting because you need to be able to shift your weight over to get the correct amount of pressure into the ball. But you can rest your foot on it while you're sitting at your desk and do a little roll. It won't be as impactful, but it does still feel good. You can find a lot of times in your day just to take a few minutes to roll your feet, and that, because your fascia is connected all the way, it's an entire web, that little bit of input affects the whole system. And you might notice a difference between your feet. My left foot feels a lot tighter. There's several more tender spots than there were in my right foot. Which is okay, it's normal. Our bodies are, symmetrical bilaterally, but because we have a dominant hand and we tend to do things unilaterally, there are differences from side to side. And so it's okay. Your body doesn't have to be 100% symmetrical as long as you are paying attention to both sides. So if you finish rolling that foot, you come back, try to touch your toes again. So now to get to the same level of stretch, I can almost put my hands flat on the floor because we affected that entire back line all the way around my forehead just by rolling my feet. And that's the power of fascia. That's how much you can change just in a few minutes. Okay, so the next one I wanted to do is another breathing exercise. And you're gonna have to lay down for this one. I'm gonna grab my phone because this is how I personally like to do it. If you have done any yoga previously, you will recognize this as Shavasana, which is corpse pose. And so you want your heels on the long edges of your mat, wider than your hips. You're gonna let your toes fall outwards. And I'm gonna grab my towel because there are some variations to this that you can do. When you lay down, you want your palms up, arms by your side, head flat on the floor. If this is uncomfortable because you don't often lay flat, you can either put the towel under your knees and bring your feet a little closer together to provide some support for your lower back. Or if you need to, you can use your towel as a pillow to provide some support for your neck if your neck and your chest are tight. But ideally, you want to get to where you can lay flat on the floor in a good position. And I like to use my phone for this because I rest it on my stomach and it's just heavy enough that I can feel it, but it's not so heavy that it interrupts my ability to breathe. I don't have to actively push against it. I can just be aware that it's there. And so it gives me an indication of, am I breathing deeply enough into my belly? Am I breathing shallowly in my chest? And so you can just relax, count your breaths, 10 to a minute, or whatever your number is. And you can just focus on the weight of the phone. And this is so good for me, if you're anything like me, because just like how I can't stop talking now, I can never shut my brain off. I can never make it stop. I was up at 2 o'clock with my son last night, and you can do this exercise for, as many minutes as you want to. It does not lose its benefit at any point. But I was up in the middle of the night with my son last night, about 2 a.m., and barely keep my eyes open. I got back in my bed and laid there for about half an hour thinking about all the things that I wanted to talk to you about today. I just am totally unable to turn my brain off. But if I have something to focus on, I can continually redirect it back to that, and it's a little bit of a meditation, which is really good for your brain. So the next one, if you're still laying on your back, don't get up. My morning routine, and I know that it's 5 o'clock in the afternoon, but this is what I do nearly every morning. If I'm really rushed in the morning, sometimes I don't get to it. You can do it in 5 minutes. You can do it in 30 minutes. It's totally up to you what you feel like your body needs that day, or what you have time for, or how you find a good routine to do it. So when you're lying on your back, your position is not as as important in this one. But this is just about finding movement in all of your joints. So I like to start at my toes. I wiggle my toes. I roll my ankles. I might pick up one leg at a time and roll my ankle and go both ways, back and forth. Straighten your leg, bend your knee, flex your hip, move it around. And if you're up against a wall like I am, some of this might be a little more challenging. I like to be out in the middle of a room when I do this. So you're going to do both sides, get some good movement. And this is really important for your joints because your joints don't have a blood supply. They don't get oxygen and nutrients from your cardiovascular system. They have fluid in them, and movement creates that fluid to infuse, well, it's fluid from the outside, but it infuses your joints with the nutrients and the oxygen and the things that it needs. And so when you stop moving your joints, they're going to start becoming not as healthy because they need that movement. So keep moving. You're going to work your way up. I like to grab my knee to work my hip, kind of do big circles, just like when you do your ankle. Your hip actually has a lot of flexibility, but because we stop moving so much and we walk in a singular plane, we lose a lot of that mobility. And so you can start, if you do this every day, you might notice the first day you don't have very big circles. But in a week or a month or next year, if you're consistent, maybe you can get your knee almost all the way to the floor. So when you feel like you've moved your hip enough, I like to sit up. You can kind of rock back and forth. Feel the ground underneath your seat bones until you feel like you're settled. And then you might bring your arms up. And this is, oh, the dog's figured out I'm on the floor. You can do, some back bends, side bends, twists, reach to the side, reach to the other side, trying to reach behind you. And the thing about doing twists is you want to make sure that you can't hunch over and then think you're going to turn around and reach behind you. You have to have the upward alignment first. So your spine has to be stacked, and then you can turn and get that twist. And you can place a hand on this knee, but don't crank yourself around because it's really about what can your body do on its own? Where are your limits? Your muscles aren't going to pull through your fascia. Your arms might pull your back through the fascia that's tight, but just getting a good twist and a stretch is not going to cause damage to that fascia. So get through your back, and then you might work your arms a little more. Do some big circles with your arms. Bend your elbows. Roll your wrists. Move your fingers. And then do your neck. Do your neck really slowly. And if you have any tenderness or pain or tightness, just pay attention to that. And then take a little note of it, and you can come back to it throughout the day. And that's why I love to do this in the morning, is because you can notice the areas in your body that need a little bit more attention, and you can come back to them throughout the day. So once you feel like you've gotten all the movement, you've done all your joints, then you can call it done. And like I said, you can spend 5 minutes doing this. I didn't time it initially, but you can do it quickly. You can take your time doing it depending on your day or what feels good to you. Just do it carefully and do it slowly and get some movement in to start your day. The next one, I talked yesterday a little bit about tummy time and why tummy time is so important for infants. And now that we're grown-ups, we don't do that. I mean, I don't know. I do know some because they do similar things to what I do and they know the importance, but most adults aren't doing tummy time anymore. We're not laying down on our stomachs to read a book or to do an activity on the floor. And so with the comforts of modern society, like an infant, our spines are returning to that C curve, and it's increasing the pressure on those discs, the vertebral discs, and it's increasing the pressure on the nerves that come out of your spine. And the first one of the most impacted curves is the one in your neck. Because if you look at your spine, you have a bit of a curve around your pelvis where your tailbone tucks under. Then you have a concave curve for your lumbar. Your thoracic curve is a little convex, and then your cervical curve is supposed to be concave again, so it goes back and forth so that it stacks and it provides structure and support, and it, what's the word I'm looking for? It absorbs some of that shock from your movement. And so when you lose that curve in your spine, it can be hard to get back. And this is a good way to start. A lot of us don't use our back muscles as much as we should be. We sit a lot. And so by getting down, and you can read a book, you can sit here and watch TV. If you have kids, kids will love it if you get down and play with them. If you haven't done this in a long time, it's really challenging to get down here and stay in this position where you might be up on your elbows and you have a good position for your head. And so some ways that you can start are by putting your head on your hands. So cross your hands in front of you and just rest your forehead on your hands. And maybe you take 10 or 12 breaths here and then get up and do it again later that day. Or maybe you do it for every commercial for a half-hour show when you watch TV at night. Get up and do some tummy time. Take some breaks from sitting on the couch, and that'll help reposition your spine back into its natural state, its correct position. You can also use your towel as a pillow. And so now you can get some more stretch in your shoulders. You could even bring your arms down and get some stretch. Don't rest into this though, because now you're cranking your neck a bit. The goal is to strengthen your back and realign your spine. And it doesn't take a lot. A few minutes a day makes a big difference. When you get really flexible, or if you don't have a lot of tension in your hips, you can throw out a leg and get some hip stretch. And this changes some of the impact, some of the forces on your back. It feels much different. If your hips are really tight and you can't get it out, you can kind of bring it lower. You can roll a little bit more onto your side and bring it out. But just getting some movement, making sure you're doing both sides. And remember, both sides might not be the same. You might be able to do it totally just fine on one side, and the other side is like, nope, not gonna happen. And that's okay. It takes time, it takes patience, it takes consistency, and you will get wherever you want to go. The next one is called Paint the Bubble. And this is one I learned from a mentor that I had when I was going through school, and it is very challenging. So the whole idea is that all the way to the edges of your fingertips, there's a bubble around you. Clear, it could be clear bubble. And you want to paint that bubble. So maybe I'll sit up a little. So you can start wherever you want, but you're going to paint with your fingertips all of the sides of that bubble, all the way around, every bit that you can reach. And this is going to get all of that shoulder mobility that we aren't getting. And it's hard the first couple of times. Get all the way back as far as you can. Reach around and get behind you. Increase that shoulder mobility, especially out to the side. You know, we sit because our hands are our most functional part. all of our work is in front of us, and we spend all our time here, and that creates tension throughout our chest. It creates length within our back, and then our back has trouble constricting and contracting and doing what we need it to do to provide that support. And then we end up with extra back pain or neck pain or inflammation and damage, herniated discs. It can get really serious if you don't pay attention to your back. And well, there's 2 more. The next one is legs up the wall. And this is good for hip mobility. This is why I wanted you to have a yoga strap or a belt, because if you have pretty good hip mobility, you can do it without. But the idea is, if you sit, this is going to be hard with this whiteboard, sit next to the wall, and then you're going to lay down and put your legs up. You might have to scoot a little closer, but you want your pelvis to be flat, little bit of curve in your lumbar spine, neutral curve, and you want to put your legs straight up. And this is going to help restore that lower back curvature, reposition the pelvis. If you want to work on your hip mobility, you can bring your legs out. It's really challenging to relax in this position because obviously gravity is pulling your feet down to the sides. And so if you take your belt and you put it around, I think I have mine backwards. Mine's a gait belt, of course, because I'm an occupational therapist. But no, it's not going to cooperate. I have to turn it around. Essentially what it does is it provides some resistance for you. So now I can relax here. If I had done my belt, I could relax and allow gravity to help that stretch happen, and focus on my breathing and count my breaths and listen to my body and what it's telling me. And if you can't get your butt bones to the wall, or it's too tight on your back, you can't maintain that curvature, then start a little further away from the wall. So you could start here and just let your feet be up. I also like to do it near the couch, where I'll lay on the couch, or not on the couch, I will lay on the floor, and I will put my feet up on the couch like this, where the backs of my thighs are against the front of the couch and my feet are resting up on a cushion. And that way it's easy to maintain that curve because you have your knees bent. You reduce the strain within your hamstrings. If you have tight hamstrings, which most of us do because we spend a lot of time sitting, this is a much easier position on your body while still allowing you to get that stretch within your back. So you can start here, work your way up. You could put some pillows on the couch and elevate so that your legs, there's a bigger angle at your knees so that your legs are almost straighter. And then eventually work your way to getting them up a wall and getting them straight. Okay, last one. And you still need the wall for this one, but I'm going to come over back closer to you. Let's see if I can explain how to do it. So, because we spend a lot of time like this, our head is not positioned over our shoulders anymore. It's here. And so getting it back takes some effort, it takes some time, it takes some practice. So what you want to do is this lower part of your head, you want to bring it back and you want to touch it, try and touch it to the back of the wall. And so you don't want your heels right up against the wall because your butt is going to push your pelvis forward. So you need your feet a little bit back so that you can have that straight line all the way up. Get your shoulders back against the wall and then squish your head back. And if you don't have this awesome double chin at least, you're not doing it right. So you need to tuck your chin a bit and actually pull your head back. And close your eyes, take a breath, count your breaths, do it for 30 seconds or a minute or however much time you have. If it starts to get uncomfortable, you've gone too long. It's kind of, I talked about fascia being one of those things you have to relax, you have to take your time. It's about breathing and managing the stress within your body. And so positions like that are harder because you have to maintain that muscle control to keep yourself upright and to keep your body in the right position. And so it's not as effective as when you're just laying down, which is one of the reasons I really like the Shavasana, because when you're laying on your back and you're flat, you are able to allow gravity to do that work for you. And so that counteracts the amount of time that we spend working on technology. Or if you like to sleep with a thick pillow, that's going to cause that as well. And there are a lot of people who I look up to who actually sleep without pillows. They don't use any pillows. They just have a mattress. And whether you sleep on your back or whether you sleep on your side, the intent for when you're sleeping is that you move a lot. You're supposed to move a lot in your sleep. That allows your fascia, as you're relaxed, to stretch itself out, to heal itself, to release those restrictions. But if you are propped and positioned and not moving, either because you can't because there's so many things in your way, or another reason, if you have to take sleep medication because you don't sleep well and that affects your brain activity, your normal sleep patterns, then you're not going to get that movement and you're not going to get that restoration of your fascia overnight. And so doing these stretches throughout the day, finding a little bit of time, the big thing for me, and the only way that it has been sustainable for me, is by finding ways to work it into my life and not by finding ways to work my life around it. So like I said, we watch TV every night. We watch Jeopardy. When we record it, so we watch it after the kids go to bed. But if I lay down and I do tummy time during those commercials, then I haven't had to rearrange my day. I haven't had to stop and schedule a time. That time was already scheduled. I'm just making better use of it. Or taking the 5 minutes, and this is scheduling it into my day, but taking the 5 minutes in the morning to move all those joints and engage all those muscles and feel where my body is and ask it what it needs. And it might seem a little silly or sound a little woo-woo, asking your body what it needs. But if you start doing it regularly, it will start telling you, and you will start being able to feel, okay, I don't want to do tummy time during Jeopardy. I want to stretch my calves because my legs are tight. And so you'll start to learn what kind of routines you need and how much time during your day you need to dedicate to getting it done. And then it becomes a habit. And not only does it become a habit, but it becomes integrated within your daily routine. So all those things that you already do, they're supporting the continuation of that habit. And that's when managing your fascia and eliminating your pain and building a healthier lifestyle really becomes possible and really becomes effective. So I think that's all I have for you guys today. It doesn't look like anybody's left any comments. If you are catching this on the replay, feel free to comment on the video in Facebook, and I will certainly catch up on those comments and make sure that everything gets answered. There's a lot more stretches and exercises and things that I could go into, but with only an hour, I'm already at 53 minutes. I just don't have the time, and it's hard in this format where I can't give you feedback or answer your questions or really get a gauge on how well it's working for you and what you need from me. So I'm going to let that be all. Tomorrow's going to be another awesome day of speakers. I think you start the morning with me again, and we are going to talk about your lymph system and immune health and how that is associated with fascia and what you can do about it. And then we'll have 2 more awesome speakers for our second to last day. So thanks for tuning in, guys. I hope you have a great night.